This film supplements the instructions for use and serves to aid understanding. This film is not a substitute for reading and understanding the instructions for use. It is also not a replacement for mandatory instructions or training courses. This video shows you an example of how to use Dräger breathing system filters in anaesthesia. The setup includes a prepared anaesthesia machine, including a hose system, a vaporizer, and soda lime. This video focuses on the placement of breathing system filters and HMEs. Differentiation can be made between the following scenarios: anaesthesia with high fresh gas flow or minimal or low flow anaesthesia and the respective patient groups: adult, pediatric, and neonatal. In high-flow anaesthesia, the lower airways are often overwhelmed with the introduction of cold and dry medical gases. Mechanical ventilation can cause damage to the lung parenchyma using a high flow of fresh gas. To avoid this, we recommend using the TwinStar HEPA Plus, a combination of filter and HME. Alternatively, the TwinStar 55 Plus can be used. Optionally, a filter can be placed between the expiratory and inspiratory ports and breathing circuit on the device side. The SafeStar 55 Plus or SafeStar 90 Plus can be selected here. For pediatric patients, a combination product of filter and HME is also recommended. The TwinStar 25 Plus or TwinStar 9 Plus is recommended for this patient category. Accordingly, a filter should be placed on the expiratory port of the device side. The SafeStar 55 Plus is recommended here. Optionally, the SafeStar 55 Plus can also be placed on the inspiratory port. For neonatal patients, the HumidStar 2 Plus is recommended. This is an HME and not a filter. Accordingly, a filter should be used on the expiratory and inspiratory ports of the device side. The SafeStar 55 Plus is recommended here. The use of low-flow anaesthesia results in heating and humidification of the ventilation gases and therefore requires other filters or combined products. For adult patients, it is recommended to use a SafeStar 55 Plus or a SafeStar 60A Plus on the Y-piece, and optionally a SafeStar 55 Plus or 90 Plus mechanical filter on the expiratory port. A mechanical filter at the inspiratory port would lead to increased condensate formation. For pediatric patients, a TwinStar 25 Plus or TwinStar 9 Plus is recommended. Accordingly, a SafeStar 55 Plus mechanical filter should be used at both the inspiratory and expiratory ports. For neonatal patients, an optional HME HumidStar 2 Plus can be used on the Y-piece. A SafeStar 55 Plus mechanical filter is recommended at the inspiratory port and expiratory port. After assembly, carefully check that all components are firmly and tightly connected and carry out the device tests described in the instructions for use. The use of filters and HME generally requires special care and supervision by the user. Not all products, features or services mentioned in this video are for sale in all countries. Contact your local Dräger representative for more information.